Wilson.
Hi.
This video offers a brief demonstration of how to present the Admission Start of Care patient folder and its contents.
And we're going to go over our policies.
Prior to reviewing and explaining the contents with a patient and/or their caregiver, you should read and understand the items for yourself. Please ask your office for a sample Start of Care folder to review and refer to while viewing this video. Please ask any questions for any area, form, or situation you may be unclear with. Let's get started. Upon arrival to the patient's home, offer your greeting.
Hi, Mr. Wilson.
Hi, you're right on time.
Well, I told you I'd be here between 9 and 10.
Set up your equipment, making sure to lay down barriers for your bag, your computer, and any other equipment, and wash your hands prior to any patient contact.
When you called yesterday, you asked me to have all of my paperwork, medical cards, and my medicines out, and here it is for you.
That's great. I really appreciate it. When I called you yesterday and said to have this ready, that's because, remember I said the visit's going to be about 2 or 3 hours. We're going to go over all of this. Now, Mr. Wilson, we're going to go over the Nightingale patient folder. This is going to stay at your home, so you need to keep it in a place where all of the Nightingale employees can have access to it.
Okay.
Inside the folder, it's a lot of information. And when I spoke with you yesterday and let you know that I was coming, I told you we were going to need about 2 or 3 hours of your time because we're going to go over this information in depth. We're going to go over your emergency care plan. We're going to go over the patient orientation for home health care book. We're going to talk about any vaccinations that you've had, and if you've had the flu shot or the pneumonia shot, and if you would like it. If you haven't, we can offer that. We're going to talk about other services that Nightingale offers that you may be interested in, and a concern is always, how's this going to be paid for, and we're going to talk about that in detail also. Anything that you sign, I'm going to have you read first and make sure you understand it, and I'm going to leave you copies of everything that you sign, and they're going to stay here in this patient handbook folder for you. All right, Mr. Wilson, the beginning of this patient orientation handbook goes over our office hours, which we're open from 8 to 5. We always have somebody on call, and you can reach us at either of these 2 numbers. This section of the book is an agency overview, and we're going to go over our policies, which is the rights and responsibilities of our agency as well as your rights and responsibilities. We're going to go over your admission criteria and make sure that you are homebound, and I'll go over what that means. And I want to remind you that home health care is short-term care. So our goal is to get you back to an independent level of functioning and then discharge you. And you and I and the rest of the staff will talk about your discharge plans every visit that we see you. And then we have the services that Nightingale provides. We have all kinds of services available. This section of the book goes over emergency preparedness plan. And what that means is, in the event of a natural or environmental disaster, that we as an agency have a plan in place for you. We're going to make every effort to continue our home care visits. However, sometimes it's just not safe for our staff to do that. If that would happen, we would call you and let you know that the staff would be unable to make a visit that day, and then they would get out to see you as soon as it was safe to do so. But every possible effort will be made to make sure that your medical needs are met. I'm going to assign you a priority code, and I'm going to put you as a priority 2. And a 2 means that you require moderate level of skilled care, and a caregiver could provide basic care during an emergency. Mr. Wilson, this section goes over charges, and I know that's always a concern to people. You have Medicare, and we accept services from Medicare, and so our agency is going to bill Medicare for the services on your behalf. So you don't even have to worry about doing that. We will accept the Medicare payment as full payment for services. However, if you decide to change your Medicare coverage, you need to let us know that as quickly as possible, because different types of Medicare providers pay differently. And so should you change during an open enrollment period and go with another Medicare provider, you'll need to let us know of that change.
Okay.
Does that make sense?
Yes.
All right. Mr. Wilson, this section goes over Medicare guidelines that are used to establish coverage. And this means that you are homebound, and they have specific guidelines that we have to follow and make sure that you are indeed homebound. Homebound means that because of your illness or injury, and you just got out of the hospital a couple days ago, that in order for you to leave your home, it takes a considerable taxing effort for you to do that, and that your visits outside of the home are infrequent and they're of short duration. So you can leave to go to the doctor, you can go to church, but those visits should be very infrequent and again have a considerable taxing effort on you and be short of duration. All right, in order to help me determine that you are indeed homebound, we're going to do this homebound determination sheet together. I'm going to ask you some questions and I want you to answer me based on your normal day's activities, all right?
Okay.
When are you dyspneic or noticeably short of breath? So do you have difficulty breathing or do you get short of breath? Is it never? When you walk more than 20 feet or climb stairs? With moderate exertion, with minimal exertion, or at rest?
With moderate exertion.
Okay, and that's a normal pattern for you.
Yes.
This is going to be a question about your walking or ambulating ability. Your ability to safely walk once you're in a standing position or to use a wheelchair once in a seated position on a variety of surfaces. And since you're in a wheelchair, are you able to independently walk? Do you require use of a device? Are you able to walk only with supervision assistance? Are you chair fast, meaning you're unable to ambulate, but you are able to wheel yourself independently in the wheelchair? Are you chair fast, but you're unable to ambulate and you're unable to wheel yourself? The last one is bed fast, which you're not in bed, so that one doesn't apply to you, which means you're unable to ambulate or to be up in a chair. So which of these do you think most accurately describes you?
Chair fast.
Okay, number 3, you're unable to ambulate, but you can move the wheelchair around yourself, correct?
Yes.
Okay, so we'll circle that one. Transportation, this is your physical and mental ability to safely use a car, a taxi, or public transportation, like a bus or a train or subway. The first response is you're able to independently drive or use a public bus. You're able to ride in a car only when driven by another person, or able to use the bus when assisted or accompanied, or unable to ride in a car, taxi, van, or bus, or unknown.
Unable to ride in the car only when driven by another person.
Okay, so that would be number 1, so we'll circle that. And I could see by your reading you have good vision. You read that very well. The last one is shopping. This is your ability to plan for, select, and purchase items in a store and carry them home or arrange delivery. The first response is you can plan and independently perform shopping tasks. So that means you can go shopping. Or B of that response is you're physically, cognitively, and mentally able to shop, but you have not done shopping in the past. 1 is you're able to go shopping, but you need some assistance. 2 is unable to go shopping. 3 is needs someone to do all shopping and errands. Which do you think most accurately describes you?
B, physically.
Okay. So we'll circle that one, and that's a 0. And I'm going to tally all of these responses up and see that you are homebound. Mr. Wilson, this section goes over problem-solving procedures, and our goal is to assist you to return to your maximum level of functioning and to provide you with services so that you can return to your independent level of functioning and stay at home, which is, I know, where you want to stay with your wife. And we're committed to assuring your rights are protected. Any and all complaints are investigated and a resolution will be documented in your file. If you feel that our staff has failed to follow our policies or has in any way denied you your rights, please feel free to follow these steps and don't be afraid of discrimination or reprisal from our company because you followed these steps. The first number is any concerns or grievances can be made in writing or by calling our Director of Clinical Services or our President, which is Dr. Brar. And you can call them at our office number here, which I've pointed out to you several times already. The second avenue for filing a complaint is the state hotline number, and that's listed here in bold print. And that hotline is available from 8 to 4:30, Monday through Friday except holidays. You can leave a message if the hours are closed. There's also a number for hearing impaired. If you have problems hearing, you can call that number, or you can submit a claim in writing to the State Department of Health. Medicare also has a hotline number, and that's listed here if you have any complaints. The third section is Nightingale has been accredited by the Accreditation Commission for Healthcare. We call it ACHC, and that's something we're very proud of. They also have a contact number, which is listed here, if you want to file a complaint with them as well.
Well, I would like to highlight these phone numbers.
That would be great. I'll lay it down so you can do that.